Non-communicable diseases account for the top 3 leading causes of death. Okay, so we talk about cancers, ischemic heart disease, and strokes. All of these are chronic non-communicable diseases, and they account for the bulk of the deaths that occur annually in St. Vincent and the Grenadines. And this is something we have to keep in mind. Some of these deaths are occurring at younger ages. The minister spoke about how these deaths are responsible for growing poverty, plunging families and community in poverty, and denying persons the right to earn a living. So this is where the collective action is needed. And action not just for people to recognize that NCDs exist, that they are responsible for heavy burden on the population, but active participation of communities in the planning of health programs, deciding what the health priorities are, agreeing how we're going to set those priorities, active involvement in the implementation of these programs, and most importantly, implementation in the evaluation of these programs, what worked, what didn't work, and why they work. And if COVID has not taught us anything, that NCDs, COVID was responsible for the fourth leading cause of death that we had. And most persons who succumbed to the SARS-CoV-2 virus were people with underlying medical conditions, the obesity, hypertension, diabetes, heart disease. And there is an accumulated risk. So the math is really not very straight. It's not 1 + 1 = 2. In this instance, it's more like 1 + 1 = 5. So there's this accumulative ripple effect that NCDs have, and we ought to be very, very, very careful. During the pandemic, we saw communities and persons and individuals making responsible decisions. I should wear my mask, I should distance myself, I'll keep my hands clean, and I'll get vaccinated. So this is the kind of tempo, this is the kind of atmosphere in which we need to move forward. And as we continue to relax the COVID-19 protocols and take away the whole issue about, what mandates are and so forth, and give more responsibility to the individual to make decisions to maintain their health, we expect the same to be done for NCDs.